All right, welcome everybody. I'm Jonathan Scott with Keystone Financial Resources. Thank you for joining us today on this webinar, and thank you, Carol Ballenger. Carol is an independent insurance specialist that we work with as a preferred partner, and she helps all of our folks get established with Medicare, answer their Medicare questions. She helps them with supplemental care. And the thing I really love about Carol is she is independent. And so she doesn't answer to any certain company. So when you sit down with Carol, you're getting really unbiased information. She tries to pair you, if you need a supplemental plan, with the one that will fit you the best. And so she is a great resource for our clients and a great friend as well. So thank you for being here, Carol.
Thank you for having me. It's good to be here on this somewhat rainy morning in October. It is busy season right now, and Jonathan, I am getting a whole lot of calls. So if I look a little dark under the eyes, it's because I'm staying up late and getting up early talking about Medicare.
Well, it's that time of year, right? It's annual enrollment, and as most of you know, that starts October the 15th, and it goes through, December the 7th, Carol?
That's correct. You got it.
Yeah, and there's a lot to be done during that period of time, if appropriate for you. And before we even get into all that, I just thought maybe, Carol, you might just start with some fundamentals in this webinar and just go back to Medicare 101, if you would, for a moment or two. And then I thought we'd just follow through with some of the questions that we hear a lot of times, and hopefully this will be helpful to a lot of people out there.
Okay, great. Happy to do that. In fact, because I believe a picture is worth 1,000 words, I have a couple of graphics here. If I can get my screen sharing to work, I will show you guys and speak from that. Here we go. Right here. Share. Go up here is where we want to start. Got that? The A, B, C, D parts of Medicare, right?
Yep.
Okay, so let's just start with a couple of definitions. I don't want to get down in the weeds, the details too much at this point, but the letters, the parts A, B, C, and D of Medicare are named in the order that they were created by Congress. So Part A is hospitalization. We used to call that major medical. And most people, when they become Medicare eligible, and for most people, that's when they hit age 65, Part A comes with no premium associated with it. Now, you can't really call it free because you've paid for it, believe me. All those years of payroll tax deduction is paid for your Part A. So most people don't have any premium for Part A. It covers your stay when you are admitted to the hospital. And it has a deductible of about $1,400. When you get both parts A and B, that's when you have what we call traditional Medicare. Part B is what covers all your doctor visits and your flu shots and your well visits and your cataract surgery. It's the way we normally think of healthcare. Most people pay $144.60 currently for their Part B premium, but if they have real high incomes or super low incomes, that will be adjusted by the federal government. They take care of all that. So Part B premium, most people $144. It has a deductible, a very small deductible by today's standards, just shy of $200. So that's Parts A and B. That's issued to you through the federal government. And if you need help figuring out how to get started on that, I can point you in the right direction, but I can't do it for you. So then after you get parts A and B, you have some choices to make. It includes Part C and D and Medicare supplements. Your Part C, what's happening on those Medicare Advantage plans? Part C is Medicare Advantage plans. And you see a lot of them being advertised these days on television because all these different companies want your business. What's happening is those companies are literally subcontracting with the federal government to be your Medicare. And there are a lot of value adds, a lot of advantages to Medicare Advantage plans. Many of them are referred to as zero premium plans. That means you're paying zero in addition to what you pay for Parts A and B. But for a zero premium plan, you can get a plan that has a deductible of zero, includes your medicine coverage, your Part D coverage, maybe some dental, vision, and hearing benefits. They've got a lot of value adds in those. And then finally, Part D is people, it's easy for folks to remember, Part D is drugs. That's your drug coverage. Back about 10 or 12 years ago, the government said if you've got Part A and B, you're required to have a Part D plan. So the parts of Medicare are A, B, C, and D. That's all governed by the government, okay? Then you've got Medicare supplements outside of that. And those letters go from A all the way to N. So just when you thought it was safe to get in the water and you knew the letters, here come more letters, and those are considered plans. So I'm going to show you down. So that's what most people's Medicare card looks like. And you see it has Part A on it and Part B on it. Once you've got that card, then the decisions that you need to make at a high level is just if you will go with traditional Medicare plus a drug plan and a supplement, or do you want to go with a Medicare Advantage plan? And the decision to go in one way versus the other is driven by a number of factors, and it's really unique to each individual that chooses it. And so I don't recommend one over the other. It really comes from the client and what they're telling me that they want and their objectives are and the way they approach healthcare. Some people are really healthy and they say, I just don't really even go to the doctor. I mean, maybe I go every year from a well visit, maybe I don't. Do you have any questions about that part, Jonathan, that folks would like to understand?
Well, yes. I mean, if I started in on the questions, because it does get very complicated. You know, you're giving clarity to even one of the subjects that I had over time, because these Medicare Advantage plans and the supplemental plans, many times they seem very close to one another, but they can actually be very different. Is that correct?
Yes. One of the biggest differences that people will regularly ask me about is that those Advantage plans, at least in our state, I'm only licensed in the state of Tennessee, okay? In Tennessee, the only kind of Medicare Advantage plan structures we have are either HMOs or PPOs, okay? And those are both networks of doctors. We understand those are networks of doctors, and whether or not your doctor is in the network is a constant issue. Many of the plans that have been around a long time have very stable networks, and it's all very consistent from year to year. But because Nashville and Middle Tennessee is as attractive a market as it is, we are constantly having new carriers enter our market and say, well, we want to get in that space. And so they're coming in, and they might not have the same wide networks that some of the more established plans have.
Okay. All right. Well, Carol, what I'm going to do, I'm going to have you take that graphic down if you would. I just want to go through some questions that we hear a lot come in, and I think this will be a really helpful part. I mean, of course, we're going to have a little hand up to the side during this webinar. If you want to request a 15-minute phone call and get some clarity on any of these things, please just press that little icon, and it will lead you through that process, and we'll have that up several times during the webinar. But if I'm somebody still working, Carol, and I'm 65 years old, do I need to do anything? This is a question we hear a lot.
That's a great question. I hear it a lot too, Jonathan. In many cases, you don't need to do anything. If you are working, you like your coverage, it's a good value, and especially, let's say you're working and you're carrying your spouse who might be younger than you and not yet eligible for Medicare, you want to keep your employer coverage, because if you leave your employer coverage, your spouse will not be eligible for coverage through that same plan.
Makes sense. Okay. All right. So if let's say that I have a supplemental plan, Carol, and I like the plan that I'm on, right? And every year I'm watching during the years they're advertising these things, especially, right around this time of year. And so I've got a supplemental plan. I like my plan. Do I need to do anything, or will it just automatically renew, and will it stay the same year to year?
Man, that's a great question. If I could clone this and tell everyone on my policyholders this answer right now, it would be helpful. If you have a plan and you like it, you really don't need to do anything. However, I would say it does behoove everyone who's a Medicare consumer to make sure that the medicines that they are taking will continue to be covered at the same level that they're experiencing in the current year in which they're having. In fact, right before hopping on this call, one of my people texted me and said, just checking in. And I wrote him back, said, I'm getting in this webinar, but send me a list of your medicines. I'll be happy to review it for you.
Mm-hmm. Good. So right now, and even this morning, it was so funny, I was watching the commercials on TV, and with the morning news, no less than 2 or 3 different supplemental plans came on in the morning news. And what they were offering, they'd say, hey, Medicare Advantage plan, and we're offering vision and dental and hearing aids, free hearing aids, and this and that and the other. When I see those, is that something that I need to try to switch to? Is that something that I need to investigate? What do I need to do when I see these new plans out?
I think it always bears just a visit to consider whether or not it would, in fact, help your situation. I had a gentleman who's a doctor, a retired doctor, and then he went back to work, and he had had his Medicare supplement for years and years, and he was hard of hearing. And so we actually put him on a Medicare Advantage plan. And he opted in and got some hearing aids well below what he would have paid on the open market. And because he had only had a Medicare supplement that whole time, we used what was called the Medicare Advantage trial right period, where you have 12 months to get back on the kind of insurance that you had previously without any health questions being asked. So, yes, what they're advertising is honestly available. Whether or not it would be great for you in your situation is another matter. And that's when the conversation and the dialogue becomes important.
And they should get a professional like you to help them, correct?
Yes. I'll let you say that, but yes, you're right.
I mean, I feel like at this point in the game, there's so many new rules, so many new plans out there that it really behooves somebody at this point to have a professional help them. And when you're getting that professional, everybody out there needs to realize that all the professionals aren't the same. There are professionals that only work with one Medicare supplemental plan. And, if you go to that person and ask their advice, the only thing they're going to take out of that toolbox is that plan. And so everything's a hammer to them. And you really want somebody that's got a toolbox that's full of tools, and we can use the appropriate tool that we need. So it really, really behooves the client to reach out to an independent person like yourself, Carol, who can really help them through all the ins and outs of each of the plans. Now, one of the last questions I want to ask you real quick is because we're in this annual enrollment period. And I know there's an open enrollment period too. And this gets all kinds of confusion about which is which and what do I do when and what's the difference. Can you answer some of those questions for us today?
I'll do my best to make it clear.
Okay.
But there are no guarantees. People can hit rewind and listen to me again. Hopefully that will clarify any confusion. So the annual enrollment period is what is available every calendar year, as you said earlier, between October 15th and December 7th. And during that amount of time, people can change their Part C or Part D plans as many times as they want, honestly. And then the last one they chose on December 7th is the one, they call it last app standing. That's the one that's going to count. Now, when people first get their A and B, both parts A and B, you remember that we talked about the original Medicare.
Right.
The first 6 months of having both A and B is considered your Medicare open enrollment period, and you can get a Medicare supplement with no health questions asked. Literally, you can have terminal cancer and get on a Medicare supplement when you first have A and B. That's just the way it works. Now, to complicate things further, this calendar year, CMS, Centers for Medicare and Medicaid Services, brought back what they call the Medicare Advantage open enrollment period. And I believe that this is a wonderful benefit to the consumers, because let's say someone did watch the television and they did think, I want that dental, vision, and hearing. I think that's the best thing since sliced bread. My current plan doesn't have that. And so they leave their current plan to get on that Advantage plan. But then when they get on that Advantage plan, come January, February, they start trying to use it and they figure out, well, they didn't tell me my doctor wasn't in this network. So the first 3 months of the year, you are allowed to make one change if you have a Medicare Advantage plan back to another, or well, it doesn't have to be your original, but you can change it one time in that first 3 months of the year.
Okay. Well, thank you, Carol. And for everybody out there, I hope this has been helpful today. If you have additional questions, again, click that hand sign to the side there. Sign up for a 15-minute phone call. We'll direct those through Carol. We'll get your questions answered. We want everybody to be taken care of appropriately, but I hope everybody has found this informational, and feel free to reach out again if you have any questions. Carol, how can they get a hold of you directly?
My best phone number is my cell, because I have it with it all the time. That phone number is 615-415-4424, or they can also reach me through my email address, carol@ballengerbrokerage.com.
Thank you, Carol. And as always, you can reach us if you have more questions at keystonefinancialresources.com or 615-661-9554. Thank each of you for listening, and have a great day. Take care.
Thank you.